Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Amna Shabbir. Thanks for joining us today, Amna.
I am so happy to be here, Kim.
And I'm really happy to have you. Let's see. So how we met, that's how I usually start. And way back on May 15th, I sent you a message and I said a beautifully poignant post on Kevin MD yesterday. So important to keep the conversation going. Thank you for doing your part to normalize seeking help and reaching out to others. And I wish you all the very best. And you thanked me, and then we followed each other's posts and communicated with LinkedIn messages. And then I invited you to collaborate on one of the group of Kevin MD articles, and you graciously agreed. It was Doctors Rediscover Joy in Practicing Medicine on Their Own Terms. And I've already had Dr. Tamara Beckford on and Dr. Robert Kornfeld, so now we're closing the loop. And Bob plays the intro music for my podcast, and I got to meet him last weekend, so that was like super fun. And then we zoomed, we zoomed in August, and so it's been like 5 months since we've chatted, so it's great to be able to chat again. And I usually also start by introducing you. And Dr. Amna Shabbir is a dual board certified physician in geriatrics and internal medicine, passionate about providing care to older adults, currently working part-time in the post-acute and long-term care setting. She is also passionate about helping doctors thrive in life after medical training as early career physicians, directly via coaching, and helping organizations with leadership development for early physician academics. She's a certified Duke Health Integrative Wellness Coach, certified professional life coach, and the founder and CEO of the Early Career Physicians Institute. Wow. That's a lot. And today we'll be talking about spreading the message of why we need to care for early career physicians, especially for the ones that just leave training and are in the first 7 years out. So what would you like our audience to most know about you as we begin our conversation today?
Thank you for that kind introduction, Kim. What I want to share with everyone is my message is to really and truly help young physicians as they transition out of medical training. And when I say young, I mean in the clinical and medical terms, not related to age. As you transition out of training and you start independent medical practice, that's a very sensitive time in your life. And that time, what happens to you will dictate so much. So I want to spread the message of normalizing that you need support and it's okay to ask for help. And really something that most people struggle with as they're trying to establish their roles and their identities as independent physicians. It's very hard to acknowledge that, yeah, I think I need help. And there's shame attached with it. There's guilt attached with it. I know we like to use the word imposter syndrome. I've used it myself, but I am more and more trying to go away from it and use the term imposterism better because we just love to pathologize everything. But I truly,
I like that. Imposter. Okay, that's great.
I really just want everyone to know that it's okay. If you are going through this, it's okay. And you can ask for help. And I want my seasoned clinician friends to also recognize that once they were in that place, and it doesn't take a lot to burn out in this healthcare system that we're in right now. And if we were to start by acknowledging and normalizing seeking help, so much can change.
Absolutely. And when I had Dr. Joe Sherman on, he said, sometimes there's a question about have you sought help or something, and he said that they should add, and if not, why not, right? It's almost like, of course you're going to need help. So it's not only should you not be surprised that you need help, like of course you should need support when you're a new attending, right?
Absolutely. And I love that part. And if not, why not? That's a good one. Dr. Sherman is amazing.
Yeah.
So I definitely agree with that because we should absolutely make it almost a part of the onboarding experience that physicians go through. You know, we teach them how the electronic medical record system works in that hospital. So let me just divide them into two parts. So there is the physician who decides to stay at the institute where they trained, and they feel more comfortable knowing the nuts and bolts where things are physically located. But they have the challenges of then proving themselves to their now colleagues, which were
Mhm.
first their quote unquote teachers attending. These are the people that taught them.
Right.
Are they being viewed as now, okay, you're graduated, you have come into your own, and now you can go and practice medicine? Are you actually blossoming? So they are then like slowly trying to prove themselves. That means that they're not saying no to a lot of tasks that are handed to them because, yeah, you have to go through a certain thing to get to that point.
Mhm.
So that's one bucket of physicians. And then there are the other ones that are starting in a completely new environment, a new system. It could be private practice, it could be a corporate medical system. That's usually what happens. So, in addition to teaching early career physicians how to onboard in the way of here's how the medical record system works, here how you code and you bill, we also need to support them in recognizing how are they feeling truly? Because when you are launching your career, you're also launching your life at the same time. A lot of people might be in the process of buying a home, starting their families, already having a family. So much is happening in life in general. It's not just what's happening inside the hospital. So it's really important to talk about that. And Kim, a lot of studies show there was one I got from the American Medical Association's website that talked about how in the first 5 years, more than 50% of the residents that start after their first job end up leaving that job.
Mhm.
And that process is not easy because as physicians, you're trained to follow the desire to perform well. You
Right.
are a perfectionist. And so when you start feeling like your job is a mismatch, you start internalizing, like, well, something's wrong with me, is
Right.
always mostly the first thought that happens.
Right. Right. Wow. Now I'm thinking, if we're speaking to mid-career physicians that are coming across newer career physicians, right? What advice would you have to them, to the mid-career physicians, to support these newer physicians?
Yeah. Um, so first of all, I will say that even at my worst points of burnout, my colleagues that were around me were such a breathing space for me. So my senior colleagues, my all the colleagues I can think of, like I'm trying to find, most of them were
Mm.
very collegial and they were always there when I asked for help. The problem was me initiating that because I didn't want to be perceived as somebody like, oh, look, she trained at such good institutes. And is that the question she's going to ask? Or so most
Mhm.
of my questions that even I did direct were more related to systems.
Mhm.
I think that for my colleagues that are in mid-career, there are first, I want them to do a check-in with themselves. How are they feeling? How are
Mhm.
they viewing their colleague? And what is it bringing from within themselves, right? If they are seeing another colleague that is struggling,
Mhm.
first question is, are they judging that person? It's
Mhm.
normal. We all have that. I mean, I am not, n- you know, a saint or anything like
Right.
that. I You
Right.
all have those tendencies. So are you judging your younger colleague who might look like they're struggling?
Mhm.
The second thing is, are you having expectations that are based off of the way that you were trained? Maybe you trained at a difficult institute. Maybe you were exposed to
Mhm.
a very toxic environment, and maybe you're still currently being exposed to a toxic environment. My one request to you is that instead of looking at it like we all have to do our time, and
Right.
we all have to gather our suffering Olympic medals,
Mm.
why don't you view it in a way, how can I help this person? And the problem with that
Mhm.
thinking is it's very sneaky because we are all at some point realizing, well, back in my day, or even for me, sometimes I felt that
Mhm.
before I had to have all these moments of reflection, like here's how I used to do things and where we used to show up. And so while there is beauty and then there is a rite of passage and all those things are there, sometimes when we're thinking and we're judging other humans that are younger than us, that are just starting
Mhm.
out their careers, thinking like they should not be burning out right now because
Mhm.
their training had work hours,
Mhm.
and now like all of the things. So if we can remove some of these judgments, I think that's one thing.
Mm-hmm.
Number two is just share a story. Share a story of
Mm-hmm.
how you were when you first started. And
Mm-hmm.
let's de-escalate, add some humor. You can talk
Mm-hmm.
about a time when you thought XYZ happened and then it was okay. So, that can just create such a nice environment in the place where you're at, because then you're emulating and you're saying that, okay, when I was just starting out, I too struggled with XYZ. Ergo, it's okay, younger physician, for you to share this. And when you share, there is definitely power in that. These days, the way the healthcare system is set up, we're running the whole day. We have to get our notes done. We have to get home. We have to, so that time where two colleagues can actually sit and talk is
Right.
diminishing.
Right.
And seeing if you can create that time and if that's
Mm-hmm.
possible. So to sum it all up, just recognizing our own biases and recognizing you were wronged. If you're a mid-career physician and you went through trauma, I want to acknowledge that. And
Right.
this is trauma. When, the Socratic method of teaching is twisted in something else and, you're feeling exposed and like you're being berated in front of 20 people. I
Right.
don't think that's medical education, but
It's
you
right.
you you know you internalize it in different forms. So if that happened to you, I see you, I recognize you, and maybe you too should work on healing your trauma. And how can you
Mhm.
share your story with just one other person and help make them feel seen and heard?
Right. I think all of that is so important. And it seems to me, the more stories I'm hearing, that no one has gone through medical school and residency without trauma, like not even related to the patients. And I think it's horrible the way the training is. And the things that you guys are exposed to, just by nature, the method of or the teaching methods. And I think that is important because some people might not recognize it as trauma. And I'm wondering if you might want to speak to just like a few examples of things that might be trauma that physicians might not think of as trauma, just to bring awareness to it.
Yeah. So I was recently talking with another colleague of mine, and um, she just constantly felt like she had, done something wrong, and she was, and if you walk through the clinical scenario, nothing had happened wrong. An elderly patient had gone through the natural course of chronic disease, unfortunately, and passed at 98. This
Mhm.
is just an example. But at that time, she's like, I just don't, I feel like I missed something and something's off. And
Mhm.
like three other people poured through the charts. And I asked, like, why are you feeling like this? And she, she brought back a time when a patient passed, and then she was very affected because the physicians that care the most about the patient and their families are also the ones that are, burning out. So
Mhm.
she remembered a time when she was training and this occurred, and she really wanted to grieve the loss of her patient,
Mhm.
but on rounds she was told to, we got to keep going.
Mhm.
And I understand it's not that the person who said that we've got to keep going, they too are the byproduct. Like it literally is, you have to keep going.
Right.
So that's something called second victim response that physicians are they have to deal with a lot. And so
Mhm.
when you're in training, if you were told to kind of rush
Mhm.
at that time, it can leave scars later on. And later on, it makes you kind of question, like, well, what happened? Did I miss something? And if not, why do I feel so bad? I mean,
Mhm.
tough it up, tough it out. Let's go. I mean, other physicians are not being affected by this. Why are you so weak? So
Right.
that is it. That is a sign that you care, and to normalize that and carry residue. I want to give a shout out to Dr. Kara Pepper over here. She on her podcast, It's Not Just You, did an episode on second victim response, which is very beautifully. She shares her personal experience.
Mhm.
So this is just one example.
Right. Yeah, no, exactly. And even sometimes, okay, you do have to keep going if you have 10 or 20 patients, right? The same thing would happen to me as a physical therapist in the nursing home if you walked in and, you found out that your patient had died overnight. And that was very upsetting, but you don't have time to like cry or be sad, right? Because you have to go to the very next room. So I fully understand that. But some things I think, and also Dr. Michael Hirsch has talked about, is that you still need time to process it later, and nobody ever does, or you're not taught that you should need to do that or that you should do that. And I'm even just learning, all of that now from you guys, because I think of all the times that happened to me through my career, right? So so that's it's normal to have feelings about your patients or what happened, and that you do need time to think about it and process it. And I love the way when you were, saying about sharing your stories. And when I had just interviewed Dr. Stephen Lewellis, right? That's, I think, what we titled our episode, and how important it is to share stories, and how if an older physician shares a story with a younger one, and then the younger one can feel, oh, I'm not alone, that is really important. So, yeah, I fully agree with that. Um, so how are early career physicians finding you? How are you reaching out to them?
Yeah. Um, well, right now, everything is through my website and my social media presence. Like I'm pretty active on LinkedIn and Instagram. And so my website is earlycareerphysician.com. And actually, as of today, I just launched something fun. It's a quiz. So you can find it at earlycareerphysician.com/quiz. And it's about how can you take back 1 hour of your time every day as an early career physician. You walk through the prompts and then you get a personalized plan delivered to your inbox. So
Nice.
I'm a little excited to share about that. I really also offer a variety of free resources. So there are paid resources and there are free resources that I offer through my website every month. Up until June, right now it's scheduled. We will be hosting a physician wellbeing Q&A series. It's once a month. I call experts that are either physician or non-physician experts that come and talk about matters of physician wellness. And you can come on, just join for free and ask questions directly. You can submit your questions in advance and you can participate anonymously. I've had two healthcare attorneys come in and talk about some sensitive issues. We've had Dr. Brittany Bussey, who is a physician who helps others establish their own practices. I had Dr. Sapna Shah talk about financial wellness. We talked about real estate investing. So all of these were experts, and the knowledge that they share, there's a lot of knowledge around us. They
Mm-hmm.
just break it down to be specific and pertinent to an early career physician, because otherwise it can be a little overwhelming. So earlycareerphysician.com.
Okay, thanks. And I love the way you're so passionate about it. And I think it comes from your personal experience, right? Like help or support that you wish you to have and you want to pass on and help others. So yeah,
Absolutely.
that's really a beautiful thing.
Yeah, I have to echo that, Kim. Someone asked at me the other day, like, why just early career physician? I said that I want to reach back in time and just embrace my younger self who was
Mhm.
struggling, not just with work. And the best part is nobody out in the outside knew,
Right.
because everything looked flawless.
Mhm.
I think only the people that were very near and dear to me, living with me knew.
Right.
So I really want to create that space of support, and whatever that might look for you, there are a variety of resources. That's the reason I founded the Institute. It's about you getting better, you
Mhm.
feeling confident as an early career physician, and you want making sure that your voice is heard.
Right. No, I love that. And I'm going back to when we were talking about how like mid or later career physicians can support earlier career physicians. Another thing is just changing a question you might ask them, instead of saying, "Do you need anything? Do you need anything from me?" Or can I help you? They're more likely to say no. But if you change the wording a little to "what can I do to support you?" or something like that, it makes it sound like, oh, okay, like there is something, it's okay that there's something, and I'll tell you which thing that is. Do you know how just the wording can make a difference?
It definitely can. That's a great way to lead with that. And you can also say, like, hey, I remember when I was XYZ in your shoes. I had a rough time. There was a lot happening in life. Is there anything I can do to support you? I think that would be just phenomenal, like leading with like acknowledging and accepting and going from there. And it can make such a huge difference. I all the times my colleagues help me, and I still am in contact with them. And it's amazing.
That's wonderful. So how about the early career physicians that you've been helping recently? Is there any stories you're like, obviously keeping it general enough? Is there any stories you'd like to share about
I think,
changes they in their lives you've been able to make?
yeah, absolutely. So one of the biggest hesitations younger physicians have is sometimes it's like, I don't want to know what I can do, and I just want to keep going because if I seek help, it's just going to make a lot of waves and ripples. And will I have to like change the place where I'm working at? Is this person trying to ignite some kind of rebellion in me? Like almost
Mhm.
where I just got done with training. I just want to keep my head down, keep working, pay my debt. I feel terrible, but I just want to keep going.
Mm,
So I had one of my clients wanted to leave, just wanted to leave work. And in fact, her testimonials on my website as well. So that's why I'm sharing publicly.
mhm,
Um, but she said the system hasn't changed. But working with Amna, I've been able to, we were able to achieve a lot of different things, such as starting from office space to creating a better schedule to small tweaks and charting to like recognizing what was underneath. So to that I say you might be struggling with something and you're hesitant to ask for help because you're worried that asking for help might actually create a bigger problem and bigger ripples.
yeah.
No, you don't have to have like some kind of cataclysmic heroic change happen.
Mhm,
If you do, I'm all for that as well. And if it's aligned with you, the
mhm,
the goal with coaching and with me working with my clients is for you to unearth what is going to be best for you. This is not
mhm,
dictatorial. And I'm there to support your journey and honor your journey.
mhm,
One of the best things I see is the transformation that happens in terms of confidence, because there's confidence and then there's arrogance and there's a big chasm in the middle. And
mhm.
we're so afraid that we're just going to quickly switch from confidence to arrogance, and that's not going to
Okay.
happen. But as you become confident and as you kind of deal and actually address your imposterism, you are able to create better boundaries with not just your colleagues, your admin staff, your leadership, but also your patients. And starting work in a sustainable way. Because right now, all through training, you're programmed to like just pressure through. You're
Mhm,
going to power through another sprint, the training is over, but now is your time to actually set the tone for your career. And actually, if you set this a sustainable tone for your career with confidence and address the concerns, you are likely going to last longer
mhm,
um, in medicine.
mhm.
And it's just joyful to see all of those transformations happen.
Yeah, well, that's beautiful. And also, I like the way you were speaking to, it doesn't have to be a huge earth-shattering changes. And I remember in the podcast we did with Kevin MD and Dr. Todd Otten and Dr. David Vessel, and Dr. David Vessel was saying, just change one thing, like take one step, right? So even reaching out to you and having a consultation, that is one step.
Absolutely. Absolutely. It's so true. And in my efforts to increase access to coaching and one-on-one support, I love there are opportunities that I create for group support, absolutely. And then there's opportunities for one-on-one support. And sometimes you want to combine the two because you're doing
Mhm,
deep work. All of it is CME funds eligible via CME-FI. So this is just to create access, like barriers that you might have in your mind. But bottom line is that help is out there. It could be just
mhm,
talking to a colleague. It could be just dropping in for a quick Q&A. It could be anything. It could be listening to this podcast.
mhm,
I want any early career physician who's feeling alone and isolated, like something is wrong with them, to not feel that way.
mhm,
Um, if you are having like morning dread, if you
mhm.
feel nauseated when you look at your schedule, you are constantly having all those are real, tangible feelings. you can do something about it. Just remember this, like no one is coming to save you, though. You
Mhm.
just have to remember that. And honestly, it's no one's job to save you. It's
Mhm.
your job, and you
Mhm.
have more agency than you realize.
Right, right. That we all have more power and control than we think we do. That's true. And the other thing is if you just think, okay, well, if I leave and get another job or this or that, but there's that famous phrase, you take yourself with you wherever you go, right? And some
Oh
of
yeah.
it is like underlying things that are going to be there at your next job as well. Things that you can change, within yourself, like you say, to set boundaries and address the imposterism and all of that. Yeah. Well,
You
that's
reminded me
go ahead.
I, you reminded me of another quotation, Kim, so I thought I'd share. It's, I believe Ralph Waldo Emerson said, the only person you will become is the person you decide to be.
Okay. Wow, that's really good. I like that. And did you want to speak a minute or so? Because our article was doctors rediscovered joy in practicing medicine on their own terms. Did you want to speak a minute or so about your own journey?
Yeah, absolutely. I I really want to underscore the fact that if you are feeling at this time that you are burnt out, or you're, frankly, a lot of people might be going through burnout and they don't realize what's happening to them. Because nobody goes like, check, check, you're burnt out. There you go. So if you don't feel good, there's a high chance that you are burnt out to some degree if you are having feeling that misalignment. And
Mhm.
then if you are completely like to the point where you're exhausted, you're cynical, you're trying to get to the end of your day, the moment the day starts at work, that's how I started feeling. Like I would sit in my car and pump myself up to get up
Right,
and go. And
right.
it's difficult. So if you feel that you're in that space, it can be very difficult to ask for help
Mm,
because you are, even asking for help is very exhausting. And I just want to highlight that. Even all these things that I have mentioned about can sound very tiring.
mhm,
All I would recommend doing is asking yourself, what is the one step you can take?
mhm,
Is there a mentor, a peer that you can talk to? I mean, definitely, I'm here, coaches are here. There's so many amazing coaches. I like talking to coaches and they have helped me tremendously because when you talk, sometimes you need to talk to your friend because you need to vent.
mhm,
And
mhm,
sometimes you want your mentor to give you advice and your peer to share their experience.
mhm,
But then you have a coach who can actually take all of that, especially if they are a physician coach, and help you navigate what that next step is. Because when you start over identifying also with that negativity, it
mhm.
just further exhausts you.
Right.
So with my experience, I started feeling the signs of burnout actually pretty much in the first couple of months. And
Mhm,
I didn't want to acknowledge that because
mhm,
that was something that happened to other people in research
mhm,
papers and wherever. This was not going to happen to me. So I really wanted to not acknowledge it, ignore it for as long as possible, and multiple parallel other things were going on. And I subsequently did ignore it for almost 4 years till I, made a change. And my solution was actually to go back in training,
mhm.
to get more training in geriatrics and
Right.
now working as a geriatrician because I realized that what gave me the most joy in medicine was caring for older adults. So you
Mhm,
can also think of it in so many different ways, but I would recommend step one, please ask for help with to
mhm,
anyone. And then step two, is there some white space that you can create in your schedule? Can you take 30 minutes, 45 minutes, an hour, something? And if you can take a longer stretch of time off just to sleep and
mhm,
meet your physiological needs, that would be great. And then see, what do you want in life? Like allow time for reflection.
mhm. I think that's terrific. And how you rediscovered joy is you pivoted slightly, but you're still practicing medicine and you're helping other your colleagues and everything. And I think that's a beautiful thing. And you have a family and you're finding time and space for all of it in a way that brings you joy and in a way you feel fulfilled.
Absolutely. It is a journey. We have to be careful. where you don't want it to creep back up. And so it's definitely a journey. I will say I am largely healed by asking for help, by making conscious decisions.
Mm-hmm.
But when I was so burnt out, I just felt like, well, this is it. Everyone feels like this. This is how life in medicine is, and there's no alternative. Whereas now I have connected with amazing individuals such as yourself, Dr. Todd Otten, like Medicine Forward is a great forum, like,
Mm-hmm.
and I'm also a part of Physician Coaching Alliance, which is another great organization to be a part of. So
Mm-hmm.
knowing all, and then it's like somebody opened this dark, dark place and light came through. And I saw all these amazing physicians not just advocating for what I was going through, but also having such inspiring stories for what another way of living life can be like.
Mm-hmm.
So please go, just take that first step.
Right, and that's what we're hoping to do. I'm hoping to do it through this YouTube channel. Is just, offering physicians hope, right? And seeing things that they can do differently, and models of all of you wonderful doctors. So thank you so much for being on today.
You're so welcome, Kim. I'm so delighted for this, and I wish more patients would continue to advocate. I mean, you a healthcare worker, and you've had your profound experiences, but I think more and more as patients learn about their physicians and their physicians' journeys, or start viewing them in a more humane light, things can start getting better, because I say our patients are the direct consumers of this
Mm-hmm.
healthcare system, and they have a right to know if
Mm-hmm.
you're going to a practice which is losing physicians and other providers, like it's literally hemorrhaging them.
Right.
You should investigate why it's this that's happening, because you are the one that's affected. Your
Right.
continuity of care is interrupted. Medical errors happen that way. Also, we know that many physicians are have already left the workforce. Many more are retiring, and the incoming classes are not too eager to go into medicine to begin with. So all of this is not creating a good consumer market. So we need to also look at it from that angle. Um, at the end of the day, we're all human, and whoever goes into medicine definitely didn't do it for the money. So to
Mm-hmm.
create a tolerable, dare I say tolerable, but happy environment for physicians and where the spaces that they work will only create a great ripple effect for patient care.
Absolutely. And that's what I'm trying to do, is get the word out, right? To help patients understand the situation, what things are like now. So thank you for all the work you're doing.
You're so
And
welcome.
okay, so in closing, to move the needle in healthcare, we all need to raise our voices, and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.